Hi, my name is Jennifer Sapp, and this is my presentation on adolescent developmental stages and eating disorders. Adolescence is an interesting stage for youth. They are changing physically, mentally, emotionally, and spiritually. Freud called this time the genital stage, believing that it is when sexual impulses return in an adolescent due to puberty. Erikson identified this time as a conflicting one, what he called identity and repudiation versus identity diffusion. He believed adolescents are in search of their identity, attempting to merge all previous identifications together to make one complete identity. The risk of failing to integrate themselves leaves the adolescent disjointed and unstable, which goes into that identity diffusion. Piaget called this stage the formal operational period. During this period, adolescents begin to think scientifically and theoretically. These theorists all identified cognitive and developmental changes that occur at a delicate time for an individual. As adolescents enter these stages, they face challenges such as establishing their identity, receiving acceptance from their peers, and finding happiness in their changing body from puberty. This is not an easy stage for everyone, as research has shown an ever-growing battle between adolescence and eating disorders. Eating disorders are psychological disorders that at their core leave the person having a morbid fear of gaining weight, and it's characterized by abnormal and disturbed eating habits. Examples of eating disorders include anorexia nervosa, bulimia nervosa, and binge eating disorder. Research shows that adolescents suffering from an eating disorder rely heavily on the opinions of others and have inaccurate internal and emotional cues, which continues to feed into their disorder. This can prevent them from even understanding the difference between feeling an emotion such as anxiety and feeling the need of hunger. They can also develop body dysmorphia, which prevents them from being able to see themselves accurately, perceiving themselves to be much larger, possibly just an area of their body inaccurately. There is an alarming amount of evidence showing the relationship between adolescence and eating disorders. A study was conducted to determine the manifestation and frequency of eating disorders and their effects on early adolescence. To do so, data was received from the Avon longitudinal study on parents and children, specifically with 13-year-old adolescents with eating disorder symptoms that was detrimental to the family and the adolescent's overall health. With the use of exploratory structural equation models to determine impairment, burden, and emotional and behavioral disorders, the results showed an alarming rate of fear of weight gain in adolescent females, with an overall avoidance of fattening foods and high levels of distress in regards to weight gain and body shape. This study also identified binging and overeating, weight and shape concern, as well as weight control behaviors as symptoms associated with eating disorders. There was a direct correlation between binge eating and functional impairment, family burdens, and comorbid psychopathy. Another study showed a correlation between adolescence and sports competitive anxiety that leads to eating disorders. 100 adolescents participated by completing Mattner's Sports Competitive Anxiety Inventory and Gardner and Garfinkel's Eating Attitudes Test. The results showed a significant correlation between sports competitive anxiety and anorexia and bulimia, especially in females. As previously stated, Freud, Erikson, and Piaget already determined significant changes in the adolescent stage that is being experienced, but then to add to it social factors such as sporting events and sporting activities, the identity and its overall health is shaken. Not only is an adolescent concerned about their overall body image, but their ability to be successful in a sports activity. These factors play strong roles in how they perceive themselves and the choices that they make in order to make their perception a reality. The best form of treatment for an eating disorder is prevention. One study conducted showed that early attachment issues led to high risk of developing the disorder in adolescence. They identified that eating disorders are at the peak in the early adolescence and showed that 1 to 4% of adolescents meet the criteria for anorexia nervosa or bulimia nervosa, and that 5% meet the criteria for eating disorders that are not specified in the DSM-4. Upon reviewing past studies, they found a direct relationship between Bowlby's attachment theory, in which the primary caregiver should seek to develop a healthy relationship with the infant, and a healthy eating lifestyle later on in adolescence. Parents can help prevent a child's eating disorder by developing a healthy relationship beginning at infancy for the future adolescent. This can be done simply by responding to the child when they're crying or when they have a need to eat, or cuddling them at such an early age. It's actually surprising to realize that at that early age, it can significantly impact healthy eating habits later on in life. Since prevention is not always possible, treatment is available. Cognitive behavioral therapy has been shown to help individuals with eating disorders overcome this debilitating disorder. It is a therapeutic approach that seeks to help clients change their counterproductive behaviors and dysfunctional ways of thinking. It allows a counselor to assist by understanding the individual's cognitive thoughts that lead to the actions, since these negative self-thoughts are what lead to unhealthy eating habits. Cognitive behavioral therapy has been altered in forms to meet the needs of individuals with specific eating disorders and at specific stages in life. A study was conducted that completed an age-appropriate cognitive behavioral therapy on 60 adolescents suffering with binge eating disorder. Some factors that were adjusted to the therapy were a greater focus on less complete motivating behavioral exercises, and a decrease in the focus on cognitive interventions, as well as a concentration on age-specific maintenance factors. The results of this study showed a higher success rate than a standard health education group. The results showed a reduction in binging by 3 months and a better weight maintenance by 9 months. While cognitive behavioral therapy is not the only form of therapy for eating disorders, it has been shown to be the leading therapeutic treatment option. It helps the adolescent as a whole, aiding them in changing their thought process in order to change their actions. It may even require them to remove themselves from certain settings that will only trigger unhealthy eating habits, with the hopes of preventing relapse. This may also involve ending friendships or quitting sports teams, which can be quite difficult, but with the proper care and counseling and support, it can be done. Parents and adults are not always aware of what's going on in a child's life, the unhealthy decisions that are being made, and the eating disorders that are being established. A study showed symptoms of eating disorders that parents were not accurately identifying in their child. Parents who were aware that their adolescent had an eating disorder were unable to identify it prior to being aware of it. In order to study this, researchers used the McKnight Risk Factor Survey and their Youth Risk Behavior Surveillance System questionnaires for the youth, and then the Developmental and Well-Being Assessment, which would be completed by parents to identify eating disorders within their child. Once the adolescents were properly diagnosed, they were separated from their parents in order to complete the questionnaires. The results found that eating disorders were prevalent in both males and females. However, bulimic symptoms were more prevalent in females. Parents were less likely to notice bulimic symptoms, but were able to notice thinness. This study is extremely beneficial for parents, as it will help them identify symptoms to look for within their adolescent in order to not assume that a child is going through puberty but is suffering from a disorder that can turn deadly. During this adolescent stage, adolescents try to break away from their parents, gaining more of their identity from their peers. It's understandable how conflicts in personality prevent parents from noticing behavioral cues, but it is essential that parents stay educated on signs in order to best care for their child. Adolescence is a challenging and changing time for a child. Theorists have identified key elements that a child is developing, which only adds to potential risk factors for their future. Eating disorders are troubling epidemics that attack our adolescents. Preventative care, symptom identification, and treatments are available to help educate loved ones and save adolescents.